All right. Well, it's about 5 after. Why don't we go ahead and get started? Thanks everyone for joining. I'm Sarah. I'm Dr. Kelly's nutritionist and project manager. Going to start with just a couple little housekeeping things, and then we'll let Dr. Kelly start answering your questions. So we are recording. The recording will be sent out at some point in the next few days for those of you who want to review or those of you who are unable to make it. For some reason, I'm not able to answer questions in the Q&A. So if you have questions, go ahead and put them in the chat. I will try to keep, sometimes the chat can run really fast, but I will try to keep track of that chat and answer your questions there. I don't know why I'm not able to answer the Q&A. So if you put a question in the Q&A down at the bottom, I'll keep an eye on that as well, but I might have to answer it in the chat. So other than that, just a quick disclaimer, this information is for educational purposes. Even though you all asked great questions and Dr. Kelly is going to answer them, it's not medical advice. So take this info to your, to your healthcare team and help them help you. But yeah, don't take this as medical advice. It is just for educational purposes. And I think that's all for me. So I'm going to make myself mute, and Dr. Kelly, go for it.
Thank you so much, Sarah. Welcome, everyone. So as Sarah mentioned, this is being recorded. If you don't want your face on the recording, you can certainly turn off your video. I love seeing people's faces, so it's totally up to you, whatever you feel comfortable with. But I wanted to remind you that you're being recorded. Okay, thank you so much for joining us. I'm really excited to answer some of these fantastic questions that you guys have submitted. And feel free to ask more questions in the chat, as Sarah mentioned, but I have everything kind of organized, or Sarah organized everything for us. So we're going to start by talking about what is mast cell activation syndrome, and we'll kind of go through in chunks the different topics. So I'll cover environmental chemicals, I'll cover mold, I'll cover testing, and so hopefully I'll get to everyone's questions. Okay, and there's a lot of resources. So if you have a pen and paper, you probably want to be able to jot down some different pieces of information like websites or books or things like that that you'll want to refer back to. And of course, you'll be able to listen to the recording too. So, okay, let's start by talking about what is mast cell activation syndrome. Because it's very complicated, right? Okay. The way that I describe this is it is a multi-symptom, multi-system, allergic, inflammatory, and sometimes growth condition, like overgrowth condition. So let's break that down. Multi-system, that means several systems in the body. So that could be the neurological system, that could be the cardiac system, gastrointestinal system, dermatologic system, pulmonary system. So multiple systems. Somebody just has like upper respiratory allergies and no other systems involved, they probably don't have mast cell activation. So that's what that piece of the definition means. And then so that was actually multi-system, and then multi-symptom. So kind of self-explanatory too. Multiple different symptoms. So you can have palpitations, you can have anxiety, you can have neurological symptoms, brain fog, fatigue, fluctuating hot and cold. You can have bleeding disorders. You can have bruising. You can have clotting disorders. You can have hormone dysregulation. You can have interstitial cystitis. There's a whole host of syndromes that go along with mast cell activation, and many of them are descriptors, right? So fibromyalgia, chronic fatigue syndrome, asthma, eczema, hives, those are all symptoms that can often be associated with mast cell activation. Okay. And then when we're talking about the allergic piece, That's pretty self-explanatory. Most people know what allergies look like. That's hives, that's itching, that can be skin manifestations, that can be respiratory manifestations, that can be gastrointestinal manifestations, and then inflammatory. So I have some patients with mast cell activation that have no allergy symptoms whatsoever. They might have chronic fatigue, they might have brain fog, they might have joint pain, but they don't have any allergy symptoms. And I think for those folks with mast cell, it may get even more complicated because they don't feel like they're the standard picture of a mast cell patient. The other thing that tends to be a clue for me in terms of somebody's history is people who tend to be reactive to things. So you could have chemical sensitivity. You might not be able to take many medications. You might have food restrictions because you have so many reactions to your foods. And many of these reactions are inflammatory in nature. There is also a growth component too. So some of the mediators that are produced by mast cells can cause excessive growth, i.e. like cysts. So if somebody tends to be very cystic, they make lipomas, they have breast cysts, they have ovarian cysts. Those are also manifestations that don't get talked a lot about with mast cell activation. And then there are plenty of other related conditions that we see with mast cell activation. So oftentimes we'll see a dysautonomia or an abnormal response in the autonomic nervous system. And this usually manifests in tachycardia or postural orthostatic tachycardic syndrome or POTS. We can also see blood pressure regulation issues. Either the blood pressure spikes when somebody has a mast cell reaction, or it drops when people have mast cell reactions. So that autonomic dysregulation, temperature irregularities, those things are very common with mast cell patients. I also see a lot of hypermobility. There's a condition called Ehlers-Danlos syndrome, which can be sometimes associated with mast cell activation. Not everybody who has EDS has mast cell, not everybody who has mast cell has EDS or a hypermobility, but tends to be more common. And the literature is getting there. There's some literature that recognizes that there's a relationship there and some that doesn't. Other conditions that often will be present with mast cell activation would be autoimmune conditions. Sometimes people will get gastrointestinal issues in terms of SIBO, small intestinal bacterial overgrowth, or gastroparesis, where again, this is an autonomic nervous system problem where the stomach motility and the gastrointestinal motility is diminished. So I think that's enough about mast cell in detail. We'll talk more about testing as we move forward. So what advice would I give somebody who is either newly diagnosed or somebody suspicious and not yet diagnosed? Couple things. I think one of the most important things, as you're probably finding, is that you have to be your own best advocate and really believe that if this is what you have to find the right care team to help you on your journey. Because unfortunately, as you've probably experienced, there are plenty of practitioners out there who don't yet know what mast cell activation is, or they have a very rigid understanding of the presentations, and they may not be open to making that diagnosis. So for example, there are what we call two consensuses in terms of the diagnostic criteria. I would be in consensus 2 camp with Dr. Lawrence Afrin and many of my colleagues, which recognize the diagnostic criteria and the definition that I've already given you. And then there's what we in consensus 2 call consensus 1 folks. And those are your more traditional allergist, immunologist who have decided that tryptase is probably the only measure of mast cell activation syndrome. And they have a rigid criteria, and many patients don't meet their rigid criteria and therefore are lost. So if you find yourself in what you suspect is a consensus 1 office and you're not getting the help that you need, I would encourage you to seek additional help. So those are some of the really important things. But in terms of like helping yourself, the good news is there are so many things that you can do, even without having a practitioner on board in the beginning. For example, you can experiment with a low histamine diet. Now, there are lots of different low histamine diets out there, and there's no perfect diet for a mast cell patient. It really has to be personalized. And so what I encourage you all and patients to do is to be rigorous as you can about keeping records so that you can identify what are the foods that you're reacting to, what are the things that you're having problems with. Now, people who have food reactions or histamine intolerance may not have mast cell activation, and people who have mast cell activation may not have histamine intolerance. I know that sounds crazy, but it's true. They're not quite the same thing. Not everyone who has mast cell activation is going to get benefit from a low histamine diet, but it's worth trying, because if you get 20% improvement, 40% improvement, it's certainly worth it, right? And that's always in your control, is what you put in your mouth. In terms of supplement trials and medication trials, many of the medications and supplements they're available over the counter. And I encourage people to give these a try. Dr. Afrin also suggests this, where you take all the different H1 blockers, that's histamine 1 receptor blockers, Zyrtec, Claritin, Allegra, Xyzal, Benadryl, that are over the counter, and try them. 1 tablet once or twice a day for a couple of weeks. See if you notice a benefit. If you don't, you move on to the next one. You can use histamine 2 receptor blockers. That would be Pepcid. And then there are a couple of prescription ones. Same thing. There are H1 blockers that are prescriptions. There are H1 blockers that are only available in countries outside of the US. And then there are tons and tons and tons of supplements. For sensitive folks, I strongly encourage you to choose single ingredient products to start with if you're sensitive, and start with small amounts. And then that way you can, because when you're trying things, what you want to do first is see if you're having an adverse reaction. So you want to try something at a small dose and then observe for possible reactions. If you have a reaction, it's probably the inactive ingredients. It may not be the active ingredient. And so you might want to look at that. And I can talk more about that too, but so start with small doses, make sure you're not having an adverse reaction, and then you can increase your doses if it seems to be helpful. And then after you've been on it for a couple of weeks, usually, then your assessment is really about, is it helping? Is it making a difference? Do I feel better? If the answer is yes, great, continue it. If the answer is no, then you move on to something else. So those are some of the first steps that I would follow in terms of diet, supplements, and medications. And then you also want to pay attention to what may be driving the mast cell reactions in the first place. So this is really about root causes. So for example, this year it's rained a lot in sunny Southern California. And so there's more mold in many people's houses. And I'll talk more about mold specifically in my experience with that. But I've had a lot more patients with a lot more symptoms in the past few months. And that may trigger allergy symptoms, worsening gastrointestinal symptoms. And so if you notice that there's a change,